I've been using Peptest now for over a year with reflux patients that I see in my clinics both in Doncaster and at Bassetlaw Hospital in Worksop. We tend to use Peptest for patients in whom we suspect laryngopharyngeal reflux. Now this is often known as silent reflux, and it's quite a different form of reflux disease to standard indigestion and heartburn, which everyone is familiar with. And so it may not be immediately apparent that these patients do have reflux disease as a cause of their throat symptoms, which may include hoarseness, sore throat, a feeling of something caught in the throat, throat clearing, cough, quite a wide range of different symptoms. And there are other potential causes of these symptoms as well. So we need to be sure we've made a firm diagnosis which is correct and we're treating the right condition. In my practice, I see approximately 12 new reflux patients every week. And of those, the majority are first time around, so we make a clinical diagnosis and start treatment. But an increasing proportion now have failed first-line medical treatment, usually under the care of somebody else. And so we need to confirm the diagnosis before we go on to try further measures with those patients. So I'm probably using Peptest 2 or 3 times every week now. If we didn't have Peptest, then the only other investigation technique we have in order to confirm the presence of laryngopharyngeal reflux would be a very invasive test, such as dual-channel 24-hour pH monitoring or multi-channel intraluminal impedance measurement. Both of those tests require having a catheter inserted down the patient's nose into the stomach and taped in place for 24 hours, which is obviously quite an invasive, unpleasant thing to have done. Whereas if we can confirm the diagnosis with a very simple test such as Peptest, it's much easier, much more convenient, much less unpleasant for the patient. I would strongly recommend Peptest because it's simple, non-invasive, relatively cheap and easy for the patients to perform.